So I specialize in sports medicine as well as hip preservation. So that includes arthroscopic and open procedures of the shoulder, knee, and hip. What I really specialize in is hip arthroscopy, and that's where we're able to make just poke hole incisions and arthroscopically go in and repair non-orthotic hip conditions like FAI or labral tears. The nice thing about having the minimally invasive surgery is you're able to A, have outpatient surgery, meaning you come in and go home the same day. B, it can make your recovery significantly faster than the procedure would be through an open approach. And C, it may get them better function and get them back to the things they'd like to do at a higher level than they otherwise would have been able to. No two patients are the same, so everyone has slightly different anatomy, slightly different injuries, and then beyond that, every patient has different goals of things that they want to get back to. Some patients may want to get back to high-level athletic function, while others may be happy just with pain-free range of motion. So I think it's important to do a patient-specific approach to every problem. The work and the relationship between the patient and the surgeon is not done at the time of surgery. There's a physical therapy process that's often involved, and oftentimes the surgeon's working with the patient up to 6 months, sometimes a year or more after surgery to make sure they're getting back to the level of activity that they want to get back to.